Welcome to the beginning of something extraordinary. I give you the Thomas F. Frist Jr. College of Medicine class of 2028.
It's been not quite a year since the inaugural class started with a slate as clean as their symbolic white coats. 50 hand-selected men and women hoping to become the first graduates of FCOM, the Frist College of Medicine at Belmont University.
It was a text from a former student of mine who, on a whim, simply said, "Hey, Dr. Spickard, how would you feel about helping start a medical school across the street?"
Before it could admit students, this medical school had to find faculty. With 2 other med schools in the same city, there was competition, but also opportunity. Dr. Anderson Spickard, who is now the dean, had a long career at Vanderbilt. He had replaced the founding dean, who had made the move with 11 other doctors and staff from Meharry. There were also hires from outside, from Vanderbilt and Lipscomb, and from inside Belmont, all seemingly excited about the challenge of building something new.
You know, it is a whole new game in that there are new models of how healthcare will be distributed. Now we have wearables, technology that patients can wear. Now we have clinics at business industries like Walmart or the grocery store, right? That is an emerging set of ideas in the system of healthcare that we believe that our providers of tomorrow need to know. So to understand business, to understand, law a little bit and ethics and how entrepreneurship can work becomes a priority here. And Belmont is unusually well suited in that regard because of our strong colleges across the university.
What Belmont does not have, though, is its own hospital and steady dollars coming in from clinical practices and ongoing research.
Here, it is about the parent university and its solvency financially, and then new models of bringing financial support into this endeavor. And, of course, philanthropy.
When it comes to philanthropy, already FCOM has been outdone by Awesome.
At Awesome, we're excited to offer a one-of-a-kind medical education experience for our students. And for those
The Alice Walton School of Medicine, funded by the Walmart heiress, is about to welcome its first class this summer. In fact, the first 5 classes there will receive full tuition gifts for all 4 years of their education. At Belmont, the inaugural class got a 30% tuition break, but just for that first year.
Which was a little disappointing, but cost didn't really play that much into my immediate decision of where I wanted to go to school. What really made me want to come here was how focused the school was in taking your own personal beliefs and your own spiritual beliefs and kind of like morphing that into you as a physician.
I applied to quite a few. Easily over 20. How I really landed on this school was, the name pops out first, Thomas F. Frist Jr. And the name Frist in health policy and in policy in general is a big name.
But it may surprise you to know no money changed hands for the naming rights on this school, though the Frist Family Foundation and HCA, the company they founded, have made 7-figure donations.
It is strictly honorary that we are carrying his name, and we are grateful that he has trusted us to do so.
Is that a missed opportunity financially?
The Frist Foundation has been incredibly supportive of us. They have been cheering us on this whole time. And while they have supported us with just targeted contributions to support us with scholarship assistance and with community outreach, those end up being grants that don't represent a standing funding relationship.
As FCOM completes its first academic year, 1 student out of the pioneering 50 has left. The same cannot be said of the faculty. There are several people on the inside describing what they call alarming staff and faculty turnover. The banner's sources have supplied names, titles, and a tally of departures from the College of Medicine. They tell us Of the 16 original faculty, including deans and chairs hired by April 1st of 2022, 10 no longer work at FCOM. That is 10 out of 16, meaning 63% have departed. If those were simply early growing pains, the same sources count 55 core faculty from day one to the present. Currently, 36 will be remaining at the end of June. 19 of the 55 have left since the school's inception, 7 since January of this year alone. That represents 35% turnover, what the Association of American Medical Colleges trend data says you'd expect to see 10 years into operation. I pose the question to Dean Spickard, who insists the numbers we've been supplied are wrong.
Since hires were made, I think in the spring of 2021, our numbers are that we've hired approximately 90 individuals. And over those 4 years, we've had 20 departures. And again, that's faculty and staff together. That's not all faculty.
After this interview, FCOM revised the numbers again, saying there had been a total of 96 hires. And not 20, but 27 people had departed, though some remain tied to the university and the College of Medicine in a community faculty role. I was told you're down to 1 pathologist and 1 physiologist from 3. Is that troublesome?
I am happy to tell you that we're able to cover those areas, but we also are, we're interviewing, I don't know how to give you numbers, but large numbers of people that are applying for those positions right now. We expect a quick turnover.
And is it always an apples-to-apples replacement? Like, does an MD get replaced with an MD or a PhD?
Often it is. We have definitions or what are called basic scientists and clinical educators. Sometimes, and you mentioned pathology, it's a little bit between. Some schools would have those folks enumerated as one or the other. But yes, we know what our needs are. We know what our learning objectives are. We know how to meet those needs. And so we build out the team to get the work done.
Are people poaching your doctors?
I don't know. They are going to other established universities for good reasons, for great contributions. And we're proud of that. And I think about the roles that I've had as a leader, even in my team, when my wonderful staff grows and takes on more responsibility and then gets recruited for somewhere else. While that's sad and it could give you feedback about oneself, it's also a story about their development that we are a part of to get them to what's next for them.
You're pretty confident you'll have sufficient faculty in every disciplinary area as you add another class this coming fall?
I'm not pretty confident. I am absolutely confident.